Hi, I'm Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It's August 26th. This is our COVID-19 video update, and I'm here with Dr. C again. Do you want to say hello?
Hi, everyone. Dr. Corriveau here, the Deputy Health Officer for the Unified Government Public Health Department.
And so this week we're going to talk about there's some new guidance for Wyandotte County for social gatherings for COVID safety reasons. And can we start out by talking about why we're doing this right now? What's going on with the COVID situation in our community that would lead to this?
Sure. Thanks, Janelle. As you all know, we've been working really hard to try and bend the curve again of this fourth wave of COVID cases that, we had a skyrocketing number of cases just here recently due to the spread of the Delta variant. Unfortunately, our hospitals are quite overwhelmed right now. I'm a physician also at KU Hospital, and I can tell you that our numbers of COVID patients there are as high as they've been, last winter. We're seeing, unfortunately, a lot of younger patients as well. And 95% of the people who are hospitalized right now have not received a vaccination, are not fully vaccinated. And that's important because we still know that vaccinations are really powerful in protecting each and every one of us from having to be hospitalized and the potential of dying from COVID. This Delta variant has really changed the game. And the difference here is that we know that even people who are vaccinated can still spread the Delta variant. And so we really need to employ other powerful methods of bending the curve at this point and mitigating the spread of COVID. And so that's why we have a mask mandate that's issued for KCK. And that's why many of our school districts are masking up as well. One other really powerful method of decreasing the spread of COVID is still social distancing. And I would say that really the two most powerful methods are wearing a mask and social distancing. So again, vaccines are still really important. They keep you and me from being hospitalized and from the potential of being intubated on a respirator, having to be hospitalized in serious condition. They prevent death. So get your vaccine. But the other ways that we prevent the spread is masking up, and then also social distancing. Now, we're coming out of the summer season. Everybody's getting back to school and work. And we're finding that at the health department, we're receiving a lot of requests for guidance as to, gathering. What should we do when we want to get together? And so we felt that it was necessary to put out some guidance for businesses, schools, just families who want to get together.
So as far as that guidance, can you talk more specifically if someone's planning like a social gathering, what do they need to keep in mind?
Sure. So for people who are fully vaccinated, we feel like it's probably a bit safer to gather, although again, there are still risks. So for an indoor gathering, we feel as though keeping those numbers to 10 or lower is probably a really good idea. And again, if you're hanging out with people who are not part of your immediate family, or you might not be sure of their vaccination status, keep that mask on. For outdoor events, we feel like, first of all, they're just safer. And so we want to say yay to outdoor events. But if you do get together with folks outdoors, even keeping those gatherings to 25 or less, it's probably safest. For those of you all who are not fully vaccinated yet, I think the safest thing is not to gather with people outside from your family.
Yeah.
Again, outdoors is safest, but there's still a risk of spreading COVID. And then, indoors, definitely 10 or less, but I really wouldn't recommend, if you're not fully vaccinated, that you hang out indoors with people who are not part of your family. Even for people who are not vaccinated, masks matter though. And so if you must be at a gathering, I just want to encourage you to mask up. And this is really about protecting yourself and your loved ones and those around you. And so again, we just want to recommend gatherings, keep them outside if at all possible.
All right, thank you so much for that. So we have this gathering guidance. It's going to be available. We'll be sharing the more details on our social media about that. And like Dr. C mentioned, vaccinations, if you haven't been vaccinated yet, are still critically important. You can get vaccinated for free. You don't have to have health insurance. So if you're looking for a place to get vaccinated, you can go to Vaccines.org or go to Vaccines.gov to find out more. Oh, Dr. C, I forgot to ask you, after hearing you talk about where things are with COVID cases and hospitalizations, I mean, I know you are still working in the hospital. Sometimes you are still seeing patients. What does that feel like right now? What does that look like for you?
Thanks for the question, Janelle. I can say, frankly, that we're very tired right now. Unfortunately, some of our staff are ill, not just from COVID, but regular illness, and then people are needing a break. I think that healthcare workers in our community and really all over the country, especially in those places that have been hard hit, are exhausted. And the risk of having a healthcare workforce that is exhausted is really that if you had something other than COVID, there wouldn't be enough people to take care of you, to take care of your family members. It's important to, I think, help decrease the spread of this virus for just the care of the people who are taking care of those who need it, So I'm sorry to bring you such a grim report, but I feel as though the tide of this pandemic has turned again to a dark place. And I think that we're going to need help going forward if we have another wave because of the exhaustion. So please, everyone, get your vaccination. It's the number one most important recommendation I have for you today. But aside from that, the thing that you can do immediately right now to help your community is to keep a mask on your face when you're in public, to limit the number of people who you're hanging out with, and also to remember to stay socially distanced. And we'll get through this together. I know we will, but times are tough.
Yeah, thank you for speaking honestly about what that looks like, because it's tough right now at hearing from your experience. I know hearing from just our health department team too, it's really challenging, and I know I'm concerned for what if someone in my life had to go to the hospital for any reason. That's going to be really challenging with all the COVID hospitalizations and the drain on healthcare staff. So thank you again for talking with us today, Dr. C.
Thank you, Janelle.